Hi guys, welcome to What's Up Doc. This is the series where we catch up with some of the most interesting doctors in the city. Today on the show with us, we have one of the most renowned cosmetic surgeons. We have Dr. Karishma Kagodu. Dr. Karishma, thank you so much for being part of What's Up Doc. How are you?
I'm great, Sriram. How are you? I'm so happy to be on the show.
It feels so good to be here. We are at Dr. Karishma's Aesthetic, by the way, the place where the magic happens.
It's all in the name.
Yeah, talk to me about what the last few months have been. I'm sure a lot of appointments that were a little doubtful. The lockdown began, plenty of procedures that were on hold. What has the last few months been like for you?
Well, amidst the last 9 months of the COVID-19 pandemic, it has been a roller coaster. We started off with the lockdown and, plastic and cosmetic surgery was put on hold by the government. It's an elective procedure. So being an elective procedure, we were put on a hold 3 months. We were at home just doing webinars and Zoom meetings. And at last we opened up in May. And since then, it's been what we thought and we did not imagine happened. That people actually started coming in to get cosmetic procedures done, and they had time on their hands. They were working from home, and in the last few months I think the number of people coming and walking into the clinic has risen significantly. I think not just in Bangalore and my clinic, but I think in India and even in America, there's already a report published saying that there's a consistent rise in cosmetic procedures. So, but it has been tough because amidst all of this, we need to take our protocols and we have to have sanitization. All the precautions, wearing our PPE kits, our respirators, the right masks, and treating all the patients. We cannot have too much of overlap, and strict sanitization, disinfection protocols have to be maintained. So it is a tough challenge where we have to do these elective procedures at the same time, make sure they are safe, and our procedure is not a reason for them to get this virus.
Right. I can understand what you're saying when people had that time to recover. Would be a great time to get a hair transplant, would be a great time to get a rhinoplasty done, because we are working from home, we are staying at home, you don't really have to be as social as you were at one point of time. So right now would be a great time to get that surgery done. Speaking of which, what are the biggest trends right now, and what are the most favored procedures that you've been conducting?
So at our clinic, we have a conglomeration of quite 3 departments. We have cosmetic plastic surgery is what I perform. Then we have a cosmetic dermatology and a range of skin procedures and lasers. And we also have cosmetic dentistry. So obviously cosmetic dentistry was possibly the last department, because the dental procedures were at highest risk of having this virus spread. So our dentistry took time, and patients were a little scared and they didn't want to come for dental procedures. However, the equipment and the PPE gear which is now available, patients are a little more at ease and calm, and now they are coming in. In terms of plastic surgery, I think we all know that we did gain an extra pound or two, while in the lockdown phase, and many of them have put on a little weight and are struggling with it and have struggled it. So I think liposuction per se, which is a fat removal technique, has been the commonest procedure that I have performed. One is that encompasses body contouring, and besides that we have a lot of women coming in for tummy tucks and looking at a recovery period which they are able to do. A lot of people came in for rhinoplasty or the nose job because normally, you had to have a plaster on your nose for 7 days, you couldn't go out, and now you are not in any social gatherings, you can sit at home, you can recover, the swelling can take its own time, and they have enough time on their hands. So whether an IT personnel, a housewife, or a working man, they all wanted something, they have been thinking about it, but were unsure, and now when they realized that the private clinics were more safer than the bigger hospitals, so that's when our patients started coming in. And I think with what happens we make sure that in the clinic they feel as safe as possible. We made sure we had our protocols in place and our COVID protocols, and so that gave them the confidence that yes, I'm safe here and I'm likely to get any cross infection from this place.
Right. Yes. I mean, none of us look the way we did a year ago because we have been at home a whole lot. I've been stress eating and meeting colleagues and friends
Doesn't
after
look
so
like
long,
that, though.
and you're like, oh my god, like you don't look the same anymore. But let's talk a little bit about showbiz.
Okay.
Showbiz and cosmetic surgeries almost go hand in hand.
True.
And is it almost a rite to passage for someone to be on the big screen, to have undergone a treatment, to have undergone a surgery?
Okay, I don't think it's a passage, and no matter what, the showbiz star or actor or actress, a model or upcoming model, it is always at the end of the day a personal desire. And if they really feel that enhancing that particular feature about themselves can give them that extra bounce or that extra lift, then they will go ahead and do it, no matter what. And it does not matter. I mean, a lot. See, when it comes to the face, is what they are most concerned about, and it could be the profile of the nose on the camera. And obviously, in showbiz, you have harsh lights and you have hard camera scenes, and every feature is so prominent. So, a lot of them would probably consider doing certain procedures to enhance, modify, or maintain something about their face or body, depending on what they are concerned about or what is coming on to the camera in focus and is troubling them. Or sometimes I would have a model come to me and say, my director thinks that my angle of my nose on that particular oblique view is not pleasing enough and you should do something about it. And somebody could just want a perfect smile and they feel that the teeth are not aligned. It could be they are self-conscious about their own thing, about their own feature. So it is not a passage and it's not a necessity. Not like it has to be done in order to get into showbiz, but a lot of them are self-conscious right from the beginning about certain features, and they feel that doing something will help them feel confident on camera. That is why they do it.
Right, and it is about confidence and one's own choice.
Yes, absolutely.
And absolute liberty and freedom.
I mean, I would do a lip filler. It's because I want it a certain way, but you may think, oh my god, what is Dr. Karishma done? Why she done that lip filler and it doesn't look good? But it's so much of a personal choice. And when I look at myself and I feel that looks good on me, I will go ahead and do it irrespective of what someone thinks of my lip filler.
Right.
Yeah.
I'm sure, over the years, the amount of taboo associated with cosmetic surgery has definitely come down to a large extent.
Yes.
Also to do with Instagram. People are on social media.
Yeah.
They need to look a certain way. There are so many filters
Oh,
that
yes.
actually make it happen even without walking into your clinic.
I mean, there's filters. There is a certain side of the face where
it gets contoured.
Yeah. I'm getting very aware of this because
Right.
since the lockdown has happened, I myself was very once upon a time camera shy, and this whole Instagram live thing has started. And when you look at it, you realize, oh yeah, why not try that filter? And that kind of takes away that side of my face, and this side of the face is better. So everybody is so conscious about that. That's more the reason that they have started to come in more numbers, and they're feeling conscious that, and especially those who are constantly in social media looking at them constantly, they want to be sometimes flawless, and there's nothing wrong about it, I think, to want to look the extra better.
You offer a range of services from head to toe. Actually, you take care of every single thing. I found tattoo removal to be really, really interesting.
Yeah.
That is one of your field of expertise as well.
Yes.
And I'm sure you've had people come up to you and say, "Doc, I don't know what happened. I was drunk. I have this thing on my body. Can you help me remove this?" All sorts of tattoo regrets you must have seen.
A lot of regrets, like I didn't know, but I'm just gonna get married after 3 months.
Right.
So
the X is on my back somewhere.
it could be all of that. Yeah.
Right.
It's just like, no, I wasn't prepared and I don't know what I was thinking. Or so we have a fantastic laser which is called the Q switch, and it's a device which just kind of shoots out these laser beams. And what it's meant to do, these laser beams are of various wavelengths. So the wavelength matters when we burst the pigments. So what the laser does is actually bursting the different colored pigments at the level of the skin.
Okay.
So we use them in different sittings, and we need to do tattoo. Doing the tattoo is a one day's job, but a tattoo removal takes sometimes months and months
sittings
together, and depending on how thick the tattoo is or how old the tattoo is, and what kind of colors are mixed in the tattoo. So we do these laser procedures in case the tattoo is too big or it's got too many mixed colors and the laser cannot take care of it. We actually look at plastic reconstructive procedures where we do a serial removal of the tattoo. They probably get a scar in return, but the scar is well placed as much as possible. Or we have to sometimes do reconstruction, like expand another area of the body where we get normal skin from and try to advance the skin and remove the tattoo surgically. So that is also something that we have done, and a lot of names have vanquished and taken off.
Taken off, erased. Not just from your memory, but from your body as well. Wow. It's amazing, like the kind of technology that is involved here and how you can make this magic happen, including a sex change operation, right?
Right.
You've had clients walk up to you who are not happy with the way they appear. Mentally, they may have changed gender, but physically as well, they wish to change that. And you can make that happen.
Yeah. So we call that the gender reassignment surgery or gender reassignment procedures. And as we know today, the whole LGBTQ community is out in the open. They are more confident and they know what they want. And even youngsters now have the ability, they have the confidence to come out to their parents and tell them that this is what I am and I have the right to be what I am. And yes, I see more and more people coming out in the open, probably wanting change of their gender in different ways. And of course, it is, we are not here to judge, but we give them what they want. So it is part of a whole set of procedures that we do, from reconstructive plastic surgeries to the top surgeries, bottom surgeries, and it could be anything. It could be just a face feminization procedures.
Oh, you have something like that?
Yes, and you have male feminization procedures, you have field masculinization procedures where the man has more stronger features and he wants to look more feminine, so we can do a little bit of lip filler. We could change the jawline a little bit to make it more softer. Men have a wider forehead, so we actually do the hair advancement in case of many men, and we could change the nose, make it look more petite, and we could do a little bit of brow changes, and so there is even facial feminization and masculinization procedures which are done. So even not only their body but the face, they want to look in another way, and the way they want. So this is becoming very common, and I'm very happy to see that in India youngsters are being very authoritative about it, and they're telling their parents and coming out in the open, and it's our job to support them.
Right. Yeah, more power to you.
Yes.
And it's amazing how you can actually make it happen. I mean, just the way you speak about it as well, it's not as simple as doing it on Photoshop, but you're actually doing it for real.
Yeah.
So that is
it's not as simple as I just put it through, but these are little complicated procedures, and
I'm sure it
sometimes
takes hours together.
You need plastic surgery and you need multi-specialities together to take on these kind of procedures, and these are all staged procedures. We did it over 1 or 2 years, and we have to put them through hormone replacement, and so it's a long process, and but when they trust you, they believe in you, and that makes the process easier for us also.
Right. Hey, it's 2021 and it's amazing the kind of progress that we actually see in today's world as well. There is a misconception, or there is an assumption that because it's cosmetology, maybe a lot of women walk in here. Plenty of guys walk into your clinic as well, and all sorts of procedures get done, right from hair transplant to what else?
So today's the metrosexual men, as you call, need not be only metrosexual, but there are a lot of men these days who are looking to take care of themselves, and they are worried about their skin. And to be honest, at this whole COVID situation in this pandemic era, we had a lot of men and guys also sitting at home and feeling dull and wondering what's happening, and they like to take care of their skin these days. They like to take care of their hair, and hair loss has always been an endless problem with men, and you know, so they come in for hair treatments like PRP and hair fall and hair transplant. It has been now more since the pandemic, and everyone with the stress is having more hair fall, so they do come in for cosmetic procedures like something we call like the gynecomastia. When you just take for an example, it's probably the commonest cosmetic procedure that I do here, and it's also termed as the male boobs or moobs, as put in the dictionary. Now it's a new term in the dictionary. So this male gynecomastia is an issue with a lot of not just young boys, also adults, young adults. We have a lot of bodybuilders who come in for this, who are, you know, taken steroids, and it's an after effect of steroid intake, etc. It could be obesity related, and they feel like self-conscious in wearing different kinds of tight-fitting clothing, or just general t-shirts, people making fun of them. Or a guy may say, you know, I go for a friend's trip and I can't even jump into the pool because I'm so conscious about my chest and body. So yes, they are also coming for liposuction. They come for the six-pack procedures. You know, those trainers who have been exercising in the gym and not able to get that body definition. So the six-pack procedures now, what is really in trend with the guys, and you know, the upper torso, the male torso contouring is we have done quite a few of them. You know, this particular last few months.
And it involves minimal invasive surgeries, and people can actually walk out the very same day.
Yeah, so many of them walk out the same day. It is obviously slightly bit invasive, but it's more to just do with underneath your skin. Anything in liposuction is just taking off fat, and we're not going internal. So it's just the fat underneath the skin, and we're just sculpting away. We're just removing the tiny bits of fat in between the muscle, just to define the muscle which already exists. So that gives the definition and shape. So that is contouring. It's not a weight loss procedure. A lot of people think of it as that, but it's more about shaping and contouring. Yeah.
I think I need to sign up right from head to toe. All sorts of things after you said it. Right from my nose, which is so very long, to everything. I mean,
now if you start asking me as a plastic surgeon, you know what a keen observer I am. I'll start noticing everything. But we are a head to toe profession, you know, from reconstruction to cosmetic.
It's truly incredible. Yeah, let's stop right here.
Yeah.
No,
start picking up anything.
No, but fabulous the way things have advanced, and definitely it is true that जो भगवान नहीं दे सकता वो डॉक्टर दे सकता है. And when anyone walks up to you, says that doctor, I need this procedure, is cosmetic surgery everyone's go-to, or can anyone, it's as easy as walking up to a doctor and saying I want a procedure done, or do you sometimes also have to do a bit of counseling?
Well, no, there's definitely a lot of, there is a part of counseling which goes into it. Not everyone walks in to my room with the confidence, or they know exactly what they're really going to do or what they want. There are a small percentage of them who know what they want. This is what I want and this is what I want to do. And, you know, but there are a lot of them who are unsure, are not sure whether to do it. There is a fear at the back of the mind. Is cosmetic surgery safe? And there are so many negative things about lipo and plastic surgery on the internet that it's, you know, there's more negative than positive for some reason. So, you know, everybody comes up to you confused at times. So we need to really counsel and try to mold them to understand what is it they really desire. And is this going to, or this procedure that I do on the person, is it going to really change their mindset? Are they going to be happy at the end of the day? And that is the whole intention, right? That whatever we do makes them happy, feel more confident and feel more bold about themselves. But if it's not going to change their perception and they're still going to be where they are, then maybe my procedure is being done out of, you know, just pure vanity. And, you know, we need to counsel them. We need to let them know what is realistic and what is possible. And, you know, when they understand all of that, you know, makes the process more transparent.
Right.
Yeah.
Right, and there's definitely a whole lot of aesthetics that are involved.
Yes, a lot of aesthetics and a lot of expectations are there, and so we need to make them realize that they need to have realistic expectations, and we can only do what is possible to an extent as the surgeon, and not everything sometimes is possible. So, understanding their wants and desires is key to giving them the procedure of choice. Otherwise, it's not about happy doctor and unhappy patient.
True.
Even if it's an unhappy doctor, it's fine, but it has to be a happy patient.
A happy patient.
So that is the end point.
Right. People may give a lot of flack on the internet for cosmetic surgeries, but it is a boon for a lot of people who opt for reconstructive surgeries, right? Like,
Yes.
let's say, for example, a freak accident, right from an acid attack survivor to someone who's had boiling water fall on them when they were a kid, or a cancer patient per se.
Yes.
You do a lot of that work as well.
Well, to be honest, since I started my clinic, the number of reconstructive procedures that I've been doing have reduced. Predominantly I have a passion towards breast reconstruction, and I do operate at the Site Care Cancer Hospital in the breast surgery department, and I'm very passionate about breast reconstruction. So if you look at a decade back, none of the women were given the option of even having the choice of getting a breast reconstructed after their mastectomy. But today, I think the number of women knowing about breast reconstruction and we giving them the option has increased, and many of them are opting for it. And Ram, age has become a number. It's not that just because you are 50 or 60 you have become old, and I do not want to look the way I looked before. So we have women not just of the younger age, say if they are afflicted with it, but even in their 50s and 60s, why I'm doing breast reconstruction, and it's planning and trying to make them feel as normal. And even if we call it reconstruction, there is an aesthetic intent to it, because it's ultimately how they're going to look and present themselves, and aesthetics go hand in hand, even if it's reconstruction, even if it's burns. And I think the maximum number of burn patients that I saw was during my residency years in St. John's, where we had a burns ward, and we were one of the only setups in Bangalore, besides the Bangalore Medical College and St. John's, of the two main plastic surgery departments handling burns. And we have done so many reconstructions, but every reconstruction we do is for a functional aspect, and also as far as possible if we can make them presentable to the outer society. So that is in whether it's acid burn victim, or it just could be a baby where hot oil spills over. So reconstruction goes hand in hand with aesthetic, and doing reconstruction, it's another challenge, but a sense of gratitude which comes from those patients is unimaginable. I mean, I do very little bit of reconstruction now, but whenever I get a chance to do it, I always love doing reconstruction. Because it's getting back a finger on your hand. It's reconstructing your hand, which is 50% of your body functions. It is implanting a toe which is lost, or a finger. So it could be a face transplant, and it could be a ear transplant. So a limb which is cut can be put back together.
My God. And I'm sure your patients can't thank you enough.
Yes.
And the fraternity overall is glad to have you here, and so is the city of Bangalore.
Yeah, I'm very proud of our fraternity of the Indian plastic surgery, and of course our Bangalore plastic surgeons, which is a great fraternity.